Healthcare professionals are learning so much more as we go through the pandemic. Now news about how COVID-19 is affecting cancer patients. Joining us now to talk about the latest findings is Dr. Peter Yu, Physician-in-Chief at the Hartford HealthCare Cancer Institute. Dr. Yu, thank you for joining us.
It's my pleasure, Lisa.
Thank you. So a new study published by The Lancet is showing that more cancer patients are dying from COVID-19, but not as a result of the cancer treatment as one might expect. Tell us about the study and its findings.
Yeah, so over the weekend, two large studies were announced, which really have a lot of bearing on this. The first study was done in the United States, Canada, and Spain. It looked at 1,000 patients who had a diagnosis of cancer and then got COVID-19 on top of that. The second study from Europe focused only on lung cancer patients and studied about 400 patients, so total 1,400 patients, a very large database to look at. The first take-home message is that having cancer and COVID is a bad combination. The risk of dying if you have COVID on top of cancer is twice what it would be otherwise, about 13%. And so that illustrates the importance of social distancing and protective measures if you have a diagnosis of cancer to really keep yourself healthy. The second point, and maybe a little bit more encouraging, is that it is possible to treat patients with a degree of safety even if you have cancer. To treat with surgery or chemotherapy or other treatments. So the study looked at patients who were diagnosed with COVID-19 and had some form of cancer surgery in the month before they were diagnosed. And it did not show any increase in death rate if you had that circumstances. So it appears that having surgery is not by itself adding to the risk of death. For other treatments like chemotherapy, it was clearly shown that certain patients can receive chemotherapy safely. Generally, those who are in healthier shape with earlier stages of cancer, the kind of cancers we think are curable. So treatment is possible, but definitely has some increased risk. And the take-home message there is that it's important to do testing for COVID-19, to know whether you have COVID-19 before you start any cancer treatments.
Okay, and Hartford HealthCare Cancer Institute played a pivotal role in this cohort study by supplying data. Can you explain what the data was that was supplied and how it was collected?
Yes. So this was a voluntary effort by cancer physicians who came across within a week, actually, and said, let's get together and let's share our data. And so Hartford HealthCare was part of this group that formed almost overnight, pulling 1,000 patients within 4 weeks. And what we did is we went through our electronic health records, we talked to our nurses and our doctors, we tracked down patients who we were treating for cancer who then had COVID, analyzed the data, and then in a de-identified way, so we respected privacy. We're able to share the data to create this large data set so we could begin to get some insights that will help us decide how to best and most safely treat patients with cancer.
Are you surprised by these findings?
Surprised, yes and no. I mean, I'm not surprised that patients with cancer and COVID have a higher risk of dying. What I was surprised to hear was that so many of our patients are able to be treated with their cancer. You know, cancer is not a disease that waits. You have to treat it. And to learn how to do it safely and to get some reassurance that it can be done safely was a very pleasant surprise.
All right, Dr. Peter Yu, thank you very much for joining us and bringing us up to date with the latest information. We appreciate it.
You're welcome, Lisa.